just tell me when the first person comes.
All right.
So, do you feel numb here?
No.
Go far? Okay. So just tell me, Gracie. Okay. So I'm going to get started. What I'm doing today is I'm doing a treatment for stretch marks. So my patient has stretch marks in this area, which is very common for women. And here, this is our third treatment. It has lightened her stretch marks significantly. This is topical numbing cream. Mm-hmm. But it has lightened her stretch marks significantly from before and has tightened them. So we are just going to do the third treatment and final treatment on them to make them look better. And so this is radiofrequency. It is a form of skin resurfacing. So I don't know if you want to come get an angle where they can see what I'm actually doing.
Yeah.
I'm just cleaning it with some alcohol. I'm going to start right here. So this is resurfacing the skin by creating little heated channels. And what it's going to do is it's going to tighten her skin and tighten her stretch marks.
Jose wished us a Happy New Year.
Hi, Jose. Happy New Year to you, too. So I'm just kind of moving around here. I pre-marked the area that I wanted to treat because once I put the numbing on, it's hard to see where I've been. So I'm just kind of working my way through here. In a minute or two, you'll be able to see the actual line that I just went because it will be red here. So I'm just going to get a little closer to that white line.
K Rizal 89 wants to know, does it feel hot?
It feels like an electrical band, like electricity going over the skin. It's kind of like if you've ever had laser hair removal, it's probably similar in feel to that, but it does feel like an electrical circuit kind of running over your skin. And then this area will feel like sunburnt.
Jose says, OMG, we are in sync. I was thinking of doing this on my lower back.
Okay.
Well, come on in, Jose.
Come on in.
You're welcome.
You know where we are. So yeah, this can really help resurface and smooth out and tighten. So she's very health conscious and works out a lot. And then also noticed some stretch marks in her calf area. So we started doing this last time when she has a scar from when she was a kid here. And so you can see where I went the first time. Now you can see it's getting a little bit redder, and then I went in this line. You can see it's getting a little pink, but you can see her stretch mark here and here, and some stretch marks in this area. So we're treating all of this. Okay.
So when can a patient expect to see results after this procedure?
This is done in a series of 3. With each treatment, you will see better results and more blending. You know, even after the 2 procedures that we did on her, it was definitely very noticeable that she had big signs of improvement. And so in the first time, I probably went like her entire butt cheek. And then this time, it's a much smaller area where I thought that she really needed it again. So everyone's different, but in general, you're going to start to see results probably more so after the second procedure. So this is radiofrequency skin resurfacing, and we're doing it for stretch mark management and to blend her stretch marks in to her, other skin. We're just kind of working our way strategically with each pass that I go, each time that I go down. I'm not bringing this device super too far over. You can see these what they call pins, but they're just these little metal attachments, and the current goes through that. And so every time I go down, I'm doing a 50% overlap from the previous one, so she gets a full treatment. So you can see how I kind of missed this one spot here. So I'm just gonna hit that. But basically I'm doing a 50% overlap with each time that I go down. So she's just getting a full, each spot is like, I go over it like twice.
Are the results permanent, or will she eventually have to do this again?
This is for stretch marks. It's to tighten and to resurface the skin. You know, once we resurface it, I don't expect her to develop stretch marks again unless she has like a major weight fluctuation. And I don't see that happening. I mean, you can really develop stretch marks at any age, but most people develop them in this area when they're growing. So it's very common among women in this area. Men get it a lot of times here on their chest or on their biceps because that's where they expand the quickest, especially if they're like weightlifting or something like that. Or on their lower back, like Jose was saying. That's a very common place too. So we left the numbing cream on her, which is a very powerful numbing cream. We left it on for approximately 45 minutes, just because it can be a little sensitive, and we just wanted to make sure that she was getting the best numbing coverage of that. Can you see, Gracie?
Mm-hmm.
So just working my way around the butt.
So who is a good candidate for this procedure?
You know, this, since it's radio frequency, is safe to use on all skin types. So really anybody that's free, that doesn't have an active infection, you know, is fine to.
Here, so you can see from this side.
Oh, sorry, I'm going over spots that I didn't numb. I can see. Okay, so I'm gonna kind of go right here. So I kind of follow this area. I'm gonna do this little area first. See, there's some spots I missed. It's easy to see where I kind of missed as I go along because they're not getting red. Here. And then I numbed her all the way down to here. So I'll finish this spot and then I'll go do this. And then I'll move to that butt cheek and then her calves. This whole, to do both butts and to do her calves, it's gonna take me probably close to 30 minutes to do the whole thing. So she looks like she's not too uncomfortable, which is great.
Can this be used to treat issues other than stretch marks?
Yes, you know, it's really good for skin resurfacing of the face, to tighten and smooth out the face, acne scars, surgical scars, what else? Enlarged pores, anything that you want to kind of resurface and tighten. I've done this on my own skin 3 times and twice during COVID. So there might be a live or something posted on my Instagram that showed me getting this done on my face. But I've done this on my face, around my eyes, on my eyelids to help tighten them, under my chin. It can be used to resurface the hands or crepey skin on the forearms. Want to do that? Almost done here. So you can kind of see where some of our stretch marks are here. They're kind of getting pink. You see these?
Mm-hmm.
So I like to just kind of get those one extra time. In a different direction than I went earlier. She has some larger stretch marks up in here, but in general, I think we got it pretty good. And then I need to get this area over here, so I'm just going to put that down a little bit.
Jose says that he got it done on his face and he loves the results. Thank you, Dr. Sarah.
Oh, you're welcome, Jose. Yeah, it can really just smooth you out and look nice. And you see here, there's some larger stretch marks in there that are whiter that we're going to try to treat right there, especially like this one. But overall, they're really blended in compared to what they used to be. They used to be a lot thicker. Is this okay?
Mm-hmm. Well, at least for the view.
So I've done this on, for people's buttock area. I've done it I did on the breasts on Ashley. She had some stretch marks on her breasts. Is that okay? You okay? Yeah. I'll try to follow these because not all the skin's bad. I'll try to just go where your stretch marks are.
So we just had a few people join us. So
Okay.
we are doing radio frequency treatment for stretch marks.
So I've already treated this area. And so now, and I've already numbed, so here's the outline of where I kind of wanted to go. And I'm just going to spot treat some of these here. So this is radio frequency skin resurfacing. It will help tighten and blend her stretch marks in better. And this is her third treatment in a series of 3. It really has made a significant difference in the appearance of her stretch marks and has allowed them to blend in to her skin a lot better and to tighten them and to shrink them. It's made a really big difference. Some of these over here were a little bit on the larger side. You can see them kind of stretched out. We only did them, I think, once up in here. We mainly focus on the buttock area. Funny, as we kind of mute out some of them, other ones seem to be more prominent that we maybe didn't notice before. I think it's maybe because we got rid of the worst ones. I think there's one here like that. Okay, I'm gonna do a little bit right here and then I think we're done with this. Sometimes the numbing may not have helped. Hopefully it's okay here. There's a few up here that I'm just gonna, we're almost done here, okay? I'm going to this. Okay. Yeah, I can see where I went before. Okay, so we're done with this buttock. We can move down here since it's a smaller area, and then I'm gonna go over there. So you can see in the back of the calf, you can see these stretch marks right here. See how they're long and linear? So we're just gonna go right here for these. And this will help blend them a lot better. There were a lot more, but after one treatment, a lot of them disappeared. So we're just down to a few left, which is great.
So for those who just joined us, how does this help with stretch marks?
So this is resurfacing of the skin. It is creating a heated, kind of like hole in the skin is the easiest way I can put it. And then the body, in order to heal that hole, will stimulate collagen to be produced, and collagen tightens the skin and remodels it and tries to produce new skin. And so it kind of tightens that whole area by producing new collagen. So this is the same philosophy like when you resurface the face for, you want to do any kind of resurfacing of the face for rejuvenating purposes and things like that. It does the same thing. So you can see her stretch marks right here. So that long white one, I'm just going over it in 2 different directions. So I'll kind of go down it this way, and then I'm going to turn the device. and I'll go parallel with it. So you can see these right here. You doing okay? You want to get a thumbs up?
Yes.
Okay, thanks. Just making sure. Okay. So this one's done right here. And it's about a 5-day healing process.
What's that healing process like?
It's like a sunburn. So if you've ever been sunburned, you know you're red and like inflamed, like how this is, red and inflamed right here. And same thing here, red. And then this is day 1. Day 2 will be a little less red. Day 3 it will start to brown, and then slowly it will just come off, and you won't even notice that it's back to kind of the way your same color as your other skin. Here you can kind of see this one here. So she's got a stretch mark running down here. She has very elastic skin. So we're just going to tighten it by going along these stretch marks and help them blend a little bit better. They were very shiny before. So in the light, you could see her stretch marks a lot more than you can now. We've only done her calves once before, so this is the second time on her calves. But it really made a huge difference blending them with the rest of the skin and have them the same color as the rest of her skin. You don't even notice them anymore, whereas before they were very shiny. So this is almost done here. I think we're getting close. That one's good. And then here, if you want to come closely, so this is a little bit different. So these were all stretch marks that I was treating, but here's a scar that she had from cutting her leg a long time ago. I don't know if you guys can see it right here, the shiny scar.
Yummy.
Can you see it?
We come around here and see if we can get a better view.
It's light now
Okay,
because I've already
that's
treated
better.
one. I've already treated it once. This you used to be able to see because it was really kind of fatter and more raised the last time she was here, but we've already treated it once. And so I'm just letting it blend in a little bit more. So that's that. So if you have scars anywhere on your body, this is really good to help mute those scars out as well. And can you give me one of these?
Mm-hmm. With alcohol?
Yeah. Okay. So you can see from here. So you can kind of see behind this knee all these white stretch marks right along here. You see that? Can you make it out?
Mm-hmm.
So they were a lot more prominent. This is her second time we're doing this area, third time on the buttocks, but second time here. She was so happy after we did the butt once that she's like, oh, wait a minute, I've got on my legs. Can we do there too? And so we added that on, and after one treatment, we really could see a difference. So hopefully in this one, she won't need a series of 3. She'll just need these 2, and they'll be blended enough that she'll be happy with it. This can also help treat crepiness of the skin as well. So I'm going to go like this to just make these a little bit better. What's great about radio frequency is that it's safe on all skin types. So whether you're very light skinned or you've got dark skin, you know, this will work on any skin type. You don't have to worry about scarring or anything like that. Whereas some lasers, you have to be careful. The darker the pigment, you shouldn't really be getting laser. Or just have to be careful and make sure that whoever you go to is conscious of the settings that they put you on. Okay. So here we did that. That looks good. I'm gonna do one more here. One more here. Okay. That looks good. And then the last area, can you actually help me just bring this on the other side of the machine?
Yes.
Great. And then, you know what, let me do this. Let me take this here that I've got her. Cover up this part of the butt. Okay, so I don't know if you want to come to this side since we can.
All right.
So she's going to be very numb on this side because you can see all this redness. It's actually bringing your stretch marks out a little bit more, but that is from the numbing cream. So all that is from the numbing cream, but you can see her stretch marks on this side a little bit more than on the other side. So we'll start out down here.
So for those of you who just joined us, we are doing radio frequency treatment for stretch marks with Venus Viva.
Yeah, so this is stretch mark management. We are resurfacing the skin to give her a nice smooth texture and to blend her stretch marks in to the rest of her skin and tighten her skin a little bit. So it's a great procedure for that. Minimal downtime and minimal discomfort as long as she has the numbing cream on, which we did. I'm just going to go over the area that I had marked. So I marked it with the white pencil so I know exactly where I wanted to treat. I'm just going to go over that with a little bit of a 50% overlap so I get each spot twice at least. This should be good. I don't know if I did the middle right here. I think I did it there. Okay, so then I'm gonna come here and kind of see right here. So this is typically done in a series of 3. It's radio frequency, skin resurfacing to help mute out the stretch marks. Just like it would tighten these stretch marks and blend them better, it does the same thing for the pores on your face or the crepiness of your hands, if you wanted to resurface either one of those as well. So it is a very, very nice procedure.
And so when we're done with the treatment, we'll be applying YovinoMD Ideal Recovery Cream. Do you want to talk about that, how that works?
That is an anti-inflammatory cream that we use to help speed up the recovery time, decrease the redness and inflammation. It is an anti-inflammatory cream that has natural ingredients in it and natural botanicals to help decrease inflammation. It's fragrance-free, gluten-free, formaldehyde-free, sulfate-free, and paraben-free, so it's great.
And it is available on our website, which is www.YovinoMDskincare.com. The link is in our bio.
And if you have had a laser procedure or any kind of procedure, that anti-inflammatory cream is great. Or if you have like rosacea or some sort of inflammatory skin condition.
Sunburn.
Yeah, sunburn. It's also really good for that too.
And it also helps.
Hopefully
if you
they're not
just
getting a
start with,
sunburn.
Well, yeah. But it also helps
Can you
if your
rotate a
skin
little bit
gets
this way?
irritated from retinol, from active ingredients like ahas and bahas.
Do you even feel this side? Probably not, huh? Not as much. It's an odd shape that I'm going in because I really wanted to mark her where I felt like she needed it the most and where the stretch marks were so prominent. Since this is the third time that we're doing this, a lot of her stretch marks faded significantly. We didn't necessarily need to go over those exact same spots again. Almost done down here. Definitely after you have one of these kinds of procedures, you want to stay out of the sun. So if you have a trip that's planned over to Mexico or somewhere warm, you definitely don't want to be doing this. And also if it's the summertime, the perfect time to do this is in the winter if you're not going to be outdoors or in a bikini. If you have a big trip planned, it's best to either plan ahead and do this, at least a month before your trip, or do it when you get back. Because you're going to be red for a little bit afterwards. So you can see these stretch marks in here. I'll just kind of hit them one more time.
Is there anything else that needs to be avoided after having this treatment besides sun exposure?
I mean, I probably wouldn't go hanging out in a jacuzzi right away. Let your skin heal, right away. Give yourself at least 5 days. Exercise, you can exercise. You may be a little bit, depends on the exercise pants that you wear. It might be a little irritating, but there's nothing that says you can't exercise the same day you get it done. Or the next day, you're not limited on anything. You don't have to wear any garments or post-procedural garments. You just want to keep the area hydrated. And looking good, Almost done here. Pulses right, right. So I'm pretty much done. I'm just gonna go, she's got some deeper, do you see how wide these ones are up here? Mm-hmm. They're super wide. So those I'm just gonna kind of target again. This can help stretch marks from pregnancy, surgical scars, like say you had a tummy tuck or you had a facelift. This can really help blend those scars in a lot better as well. Or say you just hurt yourself. Or you have old acne scars. This can help smooth those out as well. Large pores. Any areas like that. Let me just see how many I have here. 170. Okay, I think we're pretty much done. Does anybody have any last minute comments? So that's what this was. This was Venus Viva Skin Resurfacing with Radiofrequency. It's great on all skin types. It can help shrink whatever we're treating. So whether it's kind of like shrink wrap your face, if you really want a rejuvenated face, around the eyes it helps, large pores, scars, acne scars, surgical scars, stretch marks. It can really help rejuvenate and turn the skin looking new again. So we're here if you ever need it. Venus Viva. Thanks for
Bye,
watching.
everyone.